you pledged, A, that you would bend the cost curve, and B, that Democrats would be able to campaign on this. And CMS reported yesterday that the cost curve is actually bending up from 6.1% to 6.3% post-healthcare legislation. And the only Democrats I've seen talking about healthcare legislation are running TV ads saying that they voted against it. Thank you.
With respect to healthcare, what I said during the debate is the same thing I'm saying now, and it's the same thing I will say 3 or 4 years from now. Bending the cost curve on healthcare is hard to do. We've got hundreds of thousands of providers and doctors and systems and insurers. And what we did was we took every idea out there about how to reduce or at least slow the costs of healthcare over time. But I said at the time, it wasn't going to happen tomorrow. It wasn't going to happen next year. It took us decades to get into a position where our healthcare costs were going up 6, 7, 10% a year. And so our goal is to slowly bring down those costs. Now, we've done so also by making sure that 31 million people who aren't getting health insurance are going to start getting it. And we have now implemented the first phase of healthcare in a way that, by the way, has been complimented even by the opponents of healthcare reform. It has been smooth. And right now, middle-class families all across America are going to be able to say to themselves, starting this month, you know, if I've got a kid who is under 26 and doesn't have health insurance, that kid can stay on my health insurance. If I've got a child with a pre-existing condition, an insurer can't deny me coverage. If I get sick and I've got health insurance, that insurance company can't arbitrarily drop my coverage. There are 4 million small businesses around the country who are already eligible and in some cases will be receiving a 35% tax break on health care for their employees. And I've already met small businesses around the country who say, you know, because of that, I'm going to be able to provide health care for my employees. I thought it was the right thing to do. So
the CMS study from February predicted a 6.1% increase, and now post-health care, 6.3%. So it seems to have bent it up. No,
as I said, Jacob, I haven't read the entire study. Maybe you have. But you know, if what the reports are true, what they're saying is that as a consequence of us getting 30 million additional people health care, at the margins that's going to increase our costs. We knew that. We didn't think that we were going to cover 30 million people for free, but that the long-term trend in terms of how much the average family is going to be paying for health insurance is going to be improved as a consequence of health care. And so our goal on health care is if we can get, instead of health care costs going up 6% a year, it's going up at the level of inflation, maybe just slightly above inflation, we've made huge progress. And by the way, that is the single most important thing we could do in terms of reducing our deficit. That's why we did it. That's why it's important, and that's why we're going to implement it effectively.
Sorry, okay. And then the House Democrats running against health care, if you could comment on that.
Well, you know, we're in a political season where every candidate out there has their own district, their own makeup, their own plan, their own message. And, you know, in an environment where we've still got 9.5% unemployment, you know, people are going to make the best argument they can right now, and they're going to be taking polls of what their particular constituents are saying and trying to align with that oftentimes. You know, that's how political races work.